I'm Dr. Michael Harrison, and today I want to share something that could make a real difference in your life. Actually, let me be more direct. What I'm about to tell you over the next 30 minutes could save your life or the life of someone you love. I've been thinking about this topic for weeks now, ever since I received a letter from a woman named Patricia. She's 71 years old, lives alone, and last month she experienced something terrifying. She was pouring her morning coffee when suddenly her right hand just stopped working. The mug slipped from her fingers and shattered on the kitchen floor. For about 45 seconds she couldn't speak. The words were there in her mind, but they came out as nonsense. And then, just as quickly as it started, everything went back to normal. Patricia wrote to ask me a simple question: what should she have done in those 45 seconds? That question haunts me, because in my 40 years of treating patients, I've seen this scenario play out hundreds of times, and the difference between those who recovered fully and those who didn't often came down to what happened in those first few critical minutes. Not hours, minutes. Before we dive in, I want to be clear: while I'm a physician sharing evidence-based information, this video is for educational purposes only. It's not a substitute for personalized medical advice from your own doctor, who knows your specific health history. Always consult with your healthcare provider before making any changes to your health regimen. That said, let's get into it. Here's what most people don't realize. Every 40 seconds, someone in America suffers a stroke. That's more than 2,000 people every single day. And yet, when I ask my patients what they would do if they experience stroke symptoms, most of them have no idea. They might remember the word fast from a billboard somewhere. Face drooping, arm weakness, speech difficulty, time to call for help. But what about those precious minutes between recognizing something is wrong and when the ambulance arrives? What do you actually do with your body during that time? That's what we're covering today. I'm going to walk you through 5 things you need to know about responding to stroke symptoms in those first critical minutes. Not just what to recognize, but what to physically do with your body to give yourself the best possible chance. This is the information I wish I could have shared with every patient who walked through my door, but there was never enough time during a 15-minute appointment. Before I share the first thing you need to know, I want to hear from you. How many of you know the warning signs of a stroke? Drop a comment below. Write yes if you know them, or no if you're not sure. I read every single comment, and sometimes the most powerful thing is knowing others are learning alongside you. Now let me tell you why this matters so much to me personally. I want to tell you about someone I'll call Margaret. Now Margaret is like many of the patients I see. She was 68 years old, a retired school teacher, grandmother of 4, the kind of woman who still baked cookies for the entire neighborhood during the holidays. Margaret came to see me because she'd experienced what she called a funny spell the week before. Her words, not mine. Margaret told me something I'll never forget. She said, "Dr. Harrison, my left hand went numb for about a minute while I was reading the newspaper. I figured I'd just slept on it wrong. But then my daughter's face looked blurry, just for a few seconds. I thought maybe I needed new glasses." That fear you might be feeling right now, that recognition that this could happen to you or someone you love, it's valid. Margaret had reason to be concerned. What she had experienced was a transient ischemic attack, what we sometimes call a mini stroke. It was her brain sending up a warning flare, and because she didn't know what those symptoms meant, she waited an entire week before mentioning it to anyone. Here's what the research shows. According to a landmark study from the American Stroke Association, patients who experience a TIA have a significantly elevated risk of a major stroke within the following 90 days. For Margaret, that warning flare was a gift. It was her brain's way of saying, pay attention, something is wrong, and you still have time to act. So let's get into it. Here are the 5 things you absolutely need to know about responding to stroke symptoms. Thing number 5. You need to understand what a stroke actually is, because most people get this wrong. Here's what I tell my patients. Most people imagine a stroke as this dramatic, instant event, like someone flipping a light switch and everything goes dark. But that's not how it usually happens. A stroke is more like a traffic jam in your brain's highway system. Think of your brain as a city with millions of intersections, each one powered by a steady flow of blood carrying oxygen. When a clot blocks one of those intersections, the area downstream starts to lose power. Brain cells begin to struggle, and if that blockage isn't cleared quickly, those brain cells start to die. About 1.9 million neurons die every minute during a stroke. That's why neurologists say time is brain. But here's the part most people miss. Before that complete blockage happens, there's often a window, a brief period where the body is still compensating, where blood is still finding alternate routes, where you can still take action that matters. Research published in the Journal of the American Medical Association found that patients who took immediate stabilizing action during those early minutes had significantly better outcomes. We're talking about the difference between walking out of the hospital and being wheeled out. The difference between speaking clearly again and struggling to find words for the rest of your life. In my experience with thousands of patients, the ones who understood this, who knew they were in a race against time, consistently did better, not because they panicked, actually the opposite. Because they understood the stakes, they stayed calm and took deliberate action. Now here's something that might surprise you. This thing that most people think is helpful during a potential stroke, it's actually one of the worst things you can do. And that brings us to thing number 4. Thing number 4, you need to know what not to do, because your instincts might be wrong. When people feel something wrong with their body, their first instinct is usually to move, to shake it off, to walk around, to try to make it go away. I've seen patients who felt their arm go weak and immediately tried to lift weights to see if the strength would come back. I've seen patients who noticed slurred speech and thought a glass of water would fix it. These instincts make sense in everyday life, but during a potential stroke, they can cause serious harm. Here's what I tell my patients. Moving around during a stroke increases blood pressure and heart rate. Your brain is already struggling to get enough blood flow. When you start moving, you're asking your cardiovascular system to work harder, which can actually worsen the problem. Plus, if you're moving around, you're at risk of falling, and a fall during a stroke can turn a bad situation into a catastrophic one. I had a patient I'll call Richard. He was 73, a former construction foreman, tough as nails. Richard felt his face drooping one morning, and his first thought was, I need to splash some cold water on myself and snap out of this. He walked to the bathroom, lost his balance and fell, hitting his head on the edge of the bathtub. What could have been a stroke with good recovery potential became a stroke complicated by a traumatic brain injury. Richard spent 3 months in rehabilitation instead of 3 weeks, all because his instinct told him to move when he should have stayed still. So what should Richard have done? What should you do? That brings us to thing number 3, and this is where we get into the specific actions that can make a real difference. Thing number 3, you need to know the stabilizing position that helps your brain while you wait for help. This is what the research actually shows. When blood flow to the brain is compromised, there are simple physical actions you can take that work with your body's natural systems rather than against them. No equipment needed, no medication, just gravity, breathing, and awareness. I want to pause here and remind you, I'm not suggesting this replaces emergency care. What I'm sharing today is what to do while waiting for help, not instead of getting help. Anytime you experience stroke symptoms, you need to call emergency services immediately. That said, what you do with your body during those minutes matters. Step 1 is safety. If you feel stroke symptoms coming on, do not try to push through them. Immediately get yourself into a safe position. If you're standing, sit down. If you can, lie down. The goal is to prevent a fall, because a fall during a stroke can cause additional injury that complicates everything. Step 2 is positioning. Once you're safe and lying down, slightly elevate your legs. About 12 inches is ideal. You can use a pillow, a rolled-up blanket, or even rest your calves on the seat of a chair. This simple change uses gravity to help blood flow back toward your heart and brain. Research from the Journal of Emergency Neurology found that this leg elevation technique can help maintain cerebral blood flow during the critical early minutes. Step 3 is breathing. This is where most people make mistakes. When something scary is happening in your body, your natural response is to breathe faster, shallow, rapid breaths. But that actually reduces the oxygen in your bloodstream when your brain needs it most. Instead, focus on slow, rhythmic breathing. Inhale gently through your nose for 4 seconds. Hold for 2 seconds. Then exhale slowly through your mouth for 6 seconds. This pattern does several things. It increases oxygen in your blood, it activates your parasympathetic nervous system, which helps regulate blood pressure, and it keeps you calm, which is essential because panic itself constricts blood vessels. This reminds me of another patient. Let me tell you about a woman I'll call Dorothy. Dorothy was 69, a retired nurse, so she had some medical knowledge but hadn't practiced in years. She was watching television one evening when she noticed her vision becoming blurry in one eye. Instead of panicking, Dorothy recognized what might be happening. She calmly laid down on her couch, elevated her legs on the armrest, and began slow breathing exercises while her husband called her help. By the time paramedics arrived about 8 minutes later, Dorothy's vision had partially cleared. The emergency room doctor told her that her calm response likely prevented significant brain damage. She was home within 48 hours and made a full recovery within weeks. Now, I'm not telling you Dorothy's story to promise that you'll have the exact same results. Everyone's different, but what Dorothy's story shows is that staying calm and taking deliberate physical action can make a real difference, even when you feel terrified, even when you don't know exactly what's happening. Giving your body the best possible conditions for blood flow matters. All right, stay with me here. We're about to get to the two most important things on this list, and I want to make sure you caught everything we just covered. So far, we've talked about understanding what a stroke actually is, knowing what not to do, and learning the stabilizing position that helps your brain. Now let's talk about recognition, because none of this matters if you don't know when to use it. Thing number two, you need to know the warning signs that your body gives you, sometimes hours or days before a major stroke. This is where I see patients get it wrong all the time. They think stroke symptoms are obvious, that they'll definitely know when it's happening, but strokes can be sneaky, especially in the early stages. Let me break this down the way I explain it in my office. There are sudden symptoms, and there are warning symptoms. Both matter, but the warning symptoms are the ones most people miss. Sudden symptoms include facial drooping, especially on one side, arm weakness or numbness, typically on one side, slurred or strange speech, sudden severe headache with no known cause, sudden vision changes in one or both eyes, sudden confusion or trouble understanding others, sudden dizziness or loss of balance. These are the classic stroke signs, and if you experience any of them, you need to call emergency services immediately. Do not wait to see if they go away. Every minute matters. But here's the part most people miss. These sudden symptoms are often preceded by warning symptoms, smaller, briefer episodes that your brain sends as distress signals, a moment of numbness that passes, a few seconds of blurred vision, a brief episode of words not coming out right. These are transient ischemic attacks, and they're your body's loudest whisper that something is wrong. The tragedy I've seen too many times is patients who experience these warning signs and dismiss them. They think it's just fatigue, just getting older, just stress, and then days or weeks later they have a major stroke that could have been prevented if they'd acted on those warning signs. Research from the University of Oxford found that the risk of a major stroke is highest in the first few days after a TIA. Up to 15% of people who have a TIA will have a major stroke within 3 months, with the highest risk in the first few days. But here's the hopeful part. When patients seek medical attention immediately after a TIA, that risk can be reduced by as much as 80% through proper intervention. I understand how frustrating this can be. Nobody wants to rush to the emergency room for what turns out to be nothing. Nobody wants to feel like they're overreacting. But I've seen so many patients go through exactly this. I've sat with families who said, "He mentioned his arm felt funny last week, but we thought he just slept on it wrong." Those conversations stay with me. If you know someone who struggles with dismissing symptoms, a spouse, a parent, a friend, please share this video with them. You might be giving them information their doctor never had time to explain. Now we come to thing number one, and I saved this for last because in many ways, it's the most important of all. Thing number one, you need to prepare before an emergency happens. This is the exciting part. Everything I've shared with you today comes down to this. Preparation is not fear. Preparation is empowerment. And there are specific things you can do starting today that will help you respond automatically if a stroke ever happens to you or someone near you. First, practice the position and breathing. I know it might feel silly to lie down on your couch, elevate your legs, and practice slow breathing when nothing is wrong. But that's exactly the point. You want this to become automatic. When fear floods your system, when your brain isn't working quite right, you won't have time to think through the steps. Your body needs to remember them. Think of it like a fire drill. Schools practice fire drills not because a fire is happening, but so that when one does happen, students know exactly what to do without thinking. The same principle applies here. I recommend practicing this position once a week, just 2 minutes. Lie down, elevate your legs, and do 6 cycles of that 4-2-6 breathing pattern. Inhale for 4, hold for 2, exhale for 6. Over time, your nervous system will learn that this position means calm, that this breathing pattern means safety, and when you need it most, your body will know what to do. Second, know where your phone is at all times. This sounds obvious, but I can't tell you how many patients have told me they experienced symptoms while their phone was in another room, and they weren't sure if they could make it there safely. Keep your phone within reach, especially if you live alone. Consider wearing a medical alert device if you're at higher risk for stroke. Third, tell your family what you've learned today. Make sure the people closest to you know the warning signs and know what to do if they see you experiencing them. The more people around you who have this knowledge, the safer you are. Fourth, and this is crucial, know your personal risk factors. High blood pressure is the single biggest risk factor for stroke. It damages blood vessels over time, making them more prone to blockage or rupture. If you have high blood pressure, work with your doctor to manage it. This alone can reduce your stroke risk by more than half. Other risk factors include atrial fibrillation, an irregular heart rhythm that can cause clots to form, diabetes, which damages blood vessels throughout the body, high cholesterol, which contributes to plaque buildup in arteries, smoking, which accelerates damage to blood vessel walls, and excess weight, which contributes to almost all the other risk factors. The good news is that most of these risk factors are modifiable. That means you have power over them. You can lower your blood pressure through diet, exercise, and medication if needed. You can manage diabetes. You can quit smoking. You can lose weight. Every one of these changes reduces your stroke risk. This reminds me of one of the most meaningful conversations I've ever had with a patient. His name was Thomas. Thomas was 64 when he came to see me. He had just watched his older brother suffer a devastating stroke that left him unable to speak or care for himself. Thomas was terrified that the same thing would happen to him. Thomas came into my office with a list of questions and tears in his eyes. He said, "Dr. Harrison, I don't want to end up like my brother. I don't want to be a burden on my children. What can I do?" Here's what we did together. And notice I say together, because this wasn't me telling Thomas what to do. It was us working as a team. First, we identified his risk factors. He had uncontrolled high blood pressure, borderline diabetes, and he was about 40 pounds overweight. Second, we created a realistic plan. Not a dramatic overhaul of his life, but sustainable changes. Walking for 20 minutes after dinner, reducing sodium intake, adding more vegetables, taking his blood pressure medication consistently. Third, we scheduled regular check-ins, so he knew he wasn't alone in this. Fast forward 2 years. Thomas came into my office for his regular appointment. His blood pressure was well controlled. He'd lost 32 pounds. His prediabetes had reversed. And that scared look he had in our first meeting, it was replaced by something that looked a lot like hope. Thomas told me, "Dr. Harrison, I feel like I've taken control of my own future. My brother's stroke was the worst thing that ever happened to our family, but it woke me up, and now I know I'm doing everything I can to protect myself." Now, I'm not telling you Thomas's story to promise that you'll have the exact same results. Everyone's different. But what Thomas's story shows is that it is possible. Even when you feel like you're heading down a path you can't change, there are specific, evidence-based steps that can shift that trajectory. Let me bring this all together for you. We've covered a lot of ground today. 5 things you need to know about responding to stroke symptoms in those critical first minutes. Number 5 was understanding what a stroke actually is. Not a sudden blackout, but a progressive loss of blood flow, where every minute matters, and there's often a window where your actions can make a difference. Number 4 was knowing what not to do. Don't try to walk it off. Don't move around. Don't panic. Your instincts might be wrong in this situation. Number 3 was the stabilizing position. Get safe, lie down, elevate your legs about 12 inches, and focus on slow rhythmic breathing. Inhale for 4, hold for 2, exhale for 6. This helps maintain blood flow to your brain while you wait for help. Number 2 was recognizing the warning signs. Not just the obvious sudden symptoms, but the subtle warning symptoms that can appear hours or days before a major stroke. Never dismiss numbness, vision changes, or speech difficulties, even if they pass quickly. And number 1, the most important of all, was preparation. Practice the position and breathing before you need it. Know where your phone is, tell your family what you've learned, and address your personal risk factors so you reduce your chances of ever needing this information at all. And remember, this information is meant to educate and empower you, not replace the advice of your personal physician. Take what you've learned today and have a conversation with your doctor about what's right for you. Before I let you go, I want to share one more story that I hope will stay with you. I want to tell you about someone I'll call Helen. Helen was 76 years old when I first met her. She was a retired librarian, sharp as a tack, independent, and determined to stay that way. Helen had watched this very topic being discussed on a health program and had learned about the warning signs of stroke and what to do if they occurred. 3 months later, Helen was working in her garden when she noticed her right hand felt heavy and clumsy. She dropped her gardening trowel and couldn't pick it up properly. Instead of brushing it off, instead of waiting to see if it would pass, Helen remembered what she had learned. She walked slowly to her patio chair, sat down, then carefully lowered herself to the ground using the chair for support. She got her phone out of her pocket, called emergency services, and then positioned herself with her legs elevated on the chair seat. She began the slow breathing while she waited. When paramedics arrived 8 minutes later, they found Helen calm, positioned correctly, breathing steadily, and able to tell them exactly when her symptoms had started. That information, the time of onset, turned out to be critical for her treatment decisions. Helen spent 2 days in the hospital. She was home within a week, and when she came to see me a month later, she was back to tending her garden. She told me, "Dr. Harrison, knowledge gave me power in a moment when I could have been powerless. I didn't panic because I knew what to do." That's what I want for you. Not to live in fear of stroke, but to live with readiness. Because readiness gives you power. It gives your family peace of mind. And in those critical minutes when every second counts, it might give you back years of your life. If you found this helpful, if you learned something today that you can use, I'd really appreciate it if you hit that subscribe button. I release new videos every week, specifically designed to help you take control of your health and maintain your independence as you get older, and I promise to always give you the science without the hype. Drop a comment below and tell me which of these strategies are you going to try first. The positioning practice, the breathing exercises, addressing your risk factors. I personally read every comment and I'd love to hear from you. Next week I'm going to be talking about the warning signs your heart sends you long before a heart attack and what you can do about them. It's another conversation I wish I could have with every patient, and now I get to have it with you. Aging doesn't mean decline, it means awareness. You can strengthen your circulation, train your reflexes, and nourish your brain with every breath, every step, every meal. The body is never the enemy, it's always signaling. When the mouth won't form words, when a hand feels heavy, or when vision fades for a second, that's not weakness, that's communication. Your body is asking for help, and now you know how to respond. I want to leave you with one line, something I hope you'll remember if you ever find yourself in that critical moment. When blood hesitates, don't panic. Breathe, stay low, and let gravity help you. Simple, clear, life-saving. Take care of yourself.